much. Let's welcome them to Kenosha.
Thank you, Doug, and thank you everybody for showing up on this beautiful Friday. It might have been easier to be at the beach, but hopefully we'll give you some entertainment here. The topic of mental illness is something that's a passion of mine and close to our hearts, especially in veterans and first responders. It's what we both spent our careers doing thus far, because there's nuances in treating our vets. As you'll see, this is kind of a very interesting time in the movement of mental health, as in there basically was none beforehand. And these were kind of the early touch points between doctors and veterans, or doctors and mental health, as the science was brand new right around this time. So let's jump in and let's see what we're going to talk about today. Wanted to review some of the perception of mental illness before the period, so before the 1800s, kind of where we came from, how mental illness was viewed, pre-Civil War. Wanted to discuss some of the diagnoses that they were playing around with back in the day, what they called some of the conditions that soldiers or other people had come in with or were struggling with. Wanted to look at some of the possible military and civilian traumas that occurred during the Civil War period and shortly after. And then also we wanted to explore the mental health trends that came out of the Civil War, because things changed drastically within those first 10 years after the war. So, mental illness has been with us as long as there's been people. But mental illness before the 1600s was really treated more or less as a religious affliction. So as far back as Mesopotamia or Egypt or some of the other ancient societies, they believed that the mental disorder was something that was either a curse or bestowed upon the person by a deity or a god. Even in the prehistoric times, we found people that had their skulls drilled out intentionally, small holes, and that was to release the evil spirits that might have been trapped in their skull, creating their symptoms. In Egypt, they believed it was an affected state, affected your concentration, your attention, your emotions. It was later translated into hysteria and melancholy. Those are some of the early words that not even psychiatrists, but the predecessors to psychiatrists used to diagnose some of the symptoms that people were dealing with. I guess I didn't set up this slide right, it's jumping around a bit. In ancient Greece and Rome, a madness or insanity was associated with violence and with wandering around, not being able to stay put. Was also considered to be hand in hand with prophecy and mysticism. So those who were less able to be controlled or utilized would be on the outskirts of society, whereas those who had visions and other things that would be useful would become prophets or other people used in religious ceremonies. And then even into the Middle Ages, it was believed that mental illness was the result of demonic possession. This was the beginnings of medicine, as in they believed that different fluids in your body and imbalances in them would start to lead to physical conditions and mental health conditions. So if you've ever heard of the humoral theory, you're supposed to have 4 humors in your body: blood and phlegm, yellow bile and black bile, and if any of those get out of alignment, that's when you start showing symptoms. So this is when the idea of bloodletting and other things like that became the treatment of choice, to try and rebalance those humors in the body. Up until this time, and even up until the Civil War, it was really the family's responsibility to take care of the mentally ill, those who couldn't care for themselves. There were no real institutions. The only places that people would end up would be in a dungeon or a jail or exiled to the outskirts of society. And then even through the 1500s and 1700s, mental illness was still not treated, but those who were mentally ill were sent to institutions like workhouses, poorhouses, and jails. So similar to the mental health epidemic that you see nowadays, you see a lot of our people with lesser means with mental illness some of their behaviors land them in jail or in prison, and this becomes almost a boarding house for those who have emotional disturbances. So this was really where they would end up if they were trouble to society throughout the Middle Ages and into the 1700s. So there were madhouses, but they were private. They were institutions where the family would have to pay. So anybody without the inability to pay didn't have access to these. Restraints and confinement were the main treatments, behavioral treatments of choice. So people would be chained to walls or kept in straitjackets. Isolation was a form of treatment. So during Enlightenment, it was actually started to change the thinking that mental illness was not due to demonic possession or any kind of spiritual influence, but it actually had to be something organic, as in something was going on in the body or in the brain that was leading to this mental illness. So they started looking at physical causes like a head injury, or like having a serious illness or exposure to, say, heat stroke in the sun or the elements in the winter or other conditions leading to these afflictions. So now this just came around that it had always been considered a character flaw to have a mental illness. There was always something wrong with the person or their character. So while they were looking for some of these physical causes, there still was a lot of impetus that was put on the individual. And this is a moral cause. So this led up into and through the Civil War as well, was believing that somebody that was susceptible to mental illness, it was due to a character flaw. They had intemperance was a word for not being able to restrain or control one's behaviors, leading to things like alcoholism or excessive masturbation or a bunch of other things that showed poor character. And they believed that this was actually the cause of the mental illness. I think we talk a little bit later how we believe nowadays that that's actually backwards. It's first the mental illness that leads to the loss of temperance, to the loss of inhibition, and then a lot of these behavioral disturbances that you see end up being some of the coping mechanisms that the person is dealing with. So providers back then started calling themselves alienists because they believed that they were treating those who had been alienated by society. That was the first name of what we nowadays call psychiatry. These were the people who were passionate about treating the people who had been exiled and removed from society. The treatments back then actually shifted from this kind of confinement and just lock them up and hide them away to what we call moral therapy. And moral therapy wasn't the kind of therapy that we would think of nowadays, but this was the idea that instead of putting them in a hostile or constrictive, restrictive environment, to actually give them a more serene and a more safe environment to be in. So now the institutions, the few that there were, became places of sanctuary, and that's why we started calling them asylums, was because this was a way for the mentally ill to go to a place where they could find peace and they could be supportive and calm. We'll talk more about moral therapy in a little bit. So one of the early things that they called mental illness pre-Civil War was nostalgia. This dates back to the early 1700s. A Swiss physician coined the term nostalgia, and it is very similar to what it sounds like. They believed that this was caused by homesickness. It was first seen in the war between, if I remember, the Germans and perhaps the Spanish. I'm forgetting the reference now. But they saw that for long periods away from home, veterans would start showing even non-combat related symptoms of anxiety and of dread and despair and depression or exhaustion. So those who started to show mental health symptoms, it was now said that they have nostalgia, basically homesick. And the treatment was to get them home as soon as possible and give them a little time away from the front. Civil War soldiers were often far from home for long periods, as you know. The average enlistment was 3 years, but some spent 4 or 5 or 6 away from their homes. So nostalgia was a very fitting diagnosis, fit well at the time. However, during this conflict, very few actually got to go home between wars, or between battles rather. But it was also recognized as a serious camp disease that undermined the morale of both the North and the South. So soldiers would become listless, emaciated, sometimes would even die from this condition. So again, it was kind of blamed on their own internal character. They either had a weak will or some moral issue, character issue that was making them susceptible to this nostalgia. So it was really still blamed on the person themselves. So mental illness in the 1800s, this is when we started making a few more advancements to make it look a little bit more like a science. So the term psychiatry was actually coined by a German physician back in 1808. And what psychiatry actually means is soul healing, to heal the soul. So that may be due to the result of that overlap between the religion and the character and the symptoms, but that was the original intent. So now alienists, as they called themselves before, started calling themselves psychiatrists. But there were still few treatments, so what a doc would do after you met the patient would be try and mix up a tincture. Most of them were a mixture of alcohol and poison, or opiates or something else of that nature that would more or less just pacify the patient and make them less likely to have behavioral outbursts. We actually didn't get our first medication for psychiatry until 1953. So this is 150 years later, 150 years without at least a medication type treatment for any mental illness. Asylums and institutions started really ramping up at this point because of the idea of moral therapy, because of the idea that these people needed a safe and supportive place to get away. However, because of the lack of treatments, they were often committed there for life. They would spend the rest of their lives there. And you'll see that very familiar, that same story with soldiers coming out of the Civil War. Once they were institutionalized, a vast majority of them would stay at the asylum until they died. This brings up actually the movement of Dorothea Dix. Has anybody heard of Dorothea Dix? Okay, good. Fantastic lady for what she had done. She was born in 1802. In her early life, she actually started a school for girls in Boston. But in 1836, she had her own kind of mental breakdown. And because she came from a wealthy family, she was able to travel to Europe as a kind of rest, relaxation, get away from this stress. So she went there to try and improve her health. What she did while she was there is she visited multiple European institutions and asylums, including as far east as Turkey, to see the way that they were treating the mentally ill and see what these asylums look like. So this happened to be the exact same time where Great Britain was concerned about the care of their patients in their institutes and asylums. So this was called the lunacy reform, as in they were just checking out some of these older places that still used confinement and keeping people in chains or locking them in isolation. And the British Parliament was in an uproar about the actual humane treatment of the person. This is right around the Enlightenment. This is right around that time we were talking about where mental illness started being seen as more something going on with the body, and the idea that somebody could actually be cured or relieved of their symptoms. So when she returned back to the US in 1840, she started going throughout the states. She started in her home state of Massachusetts and toured the different facilities that were there and started writing papers and letters, finalizing it into a memorial that she pursued, that she went to the state legislature with, and she was actually able to get reform passed within the legislature. She had wrote, "The present state of illness or of insane persons confined within the Commonwealth in cages, stalls, and pens, chained, naked, beaten with rods, and lashed into obedience." So this was very typical of the type of things you would see inside an asylum or institute throughout the world pre-Civil War. It was Dorothea Dix, and it was this movement to humanize the care of the mentally ill, in large part, that led to moral therapy and treating people as people, regardless of their symptoms. So in 1844, right after she finished the reform in Massachusetts, she went and did the exact same thing in New Jersey. Went around, toured, started writing letters to the Senate, came up with a report, and got New Jersey to change the way that they were treating the mentally ill. And the rest of her career, more or less, before her period in the Civil War, she traveled to various states throughout both the North and the South, doing that exact same thing, looking at the state of their mental health care and their asylums, and creating this reform movement to humanize the treatment of the mentally ill. During the Civil War in 1861, she was appointed as the superintendent of Army nurses by the Union Army. So she set a set of guidelines. Have you all heard this? It's very interesting. She had her own rules for what nurses were supposed to do and how they should behave. She insisted that volunteers be between the ages of 35 and 50. She didn't want any of the younger ladies to be around. She insisted that they all be very plain looking, no cosmetics, no jewelry. They could only wear black or brown unhooped skirts. This was really to try and protect them, either from the men, the patients they would be treating, or actually from the physicians who may take advantage of somebody. So, but she was also very particular in the way that her nurses would behave, and she was more or less notorious for firing nurses that she hadn't trained herself. She demanded the treatment of both Union and Confederate soldiers alike. So when she was on the battlefield or nearby, she didn't make a difference between the two. They would all be treated. She often conflicted and got into fights with Army doctors, not just about personnel and nurse hiring and firing, but also kind of the conditions within the hospital facilities. During her time, the Army nursing program implemented over 3,000 women into the nursing corps. So incredible. This was at a time where a lot of the physicians didn't want to work with females. That was something that Dorothea Dix actually fought against the physicians about, was insisting that nurses, that females would be allowed to serve as nurses and in the Army Corps of Nursing. She resigned her position in August of 1865. So another early diagnosis, another trial at this trauma warfare leading to symptoms was in the early 1800s, 1829. They called it neurasthenia. And this was basically kind of an anxiety, but in that movement to find an organic cause, they started looking more and more at the physical symptoms of the mental illness rather than just the behavior or the thinking conditions. So you would see fatigue and anxiety and headache and heart palpitation, high blood pressure. Neuralgia is a type of nerve pain or numbness or tingling that you can get, and depressed mood. It wasn't actually until the mid-1800s, right before the Civil War, when they found the first kind of traumatic effect that could affect mental health. It was called railway spine. Before this, they didn't believe that nearly any physical cause could cause a mental derangement or mental health symptoms. So this was the first kind of push towards that. A single event or experience can start causing mental health symptoms. They called it railway spine because it was seen primarily in railroad accidents. If you all know some of the history of like the railroad, it was actually a very dangerous way to travel. Anything that would get up on the rails or something could derail the entire train. So there were several railway accidents. And they found that a lot of people who were in these accidents afterwards started suffering from insomnia, feeble pulse, pallor, feverishness, constipation, intolerance. They didn't want to go anywhere near a railroad after that, right? So this was seen as a disease that was caused actually by the impact or the shaking of the train as it fell, rather than the experience itself. It was closer, but it was still blamed on this, you got banged in the head or you got shooken around, instead of the experience being actually traumatic on its own. So most symptoms were self-limited, and the treatment was basically to try and get them back on the train. That's what we call exposure therapy. Shortly after the Civil War, DaCosta syndrome, or soldier's heart, was another one of these attempts at kind of tying trauma, emotional trauma, to the mental illness. So, after studying over about 300 Civil War soldiers and looking at the findings, Dr. DaCosta came up with this set of symptoms: fatigue upon exertion, meaning that you'd get tired really easily whenever you were trying to do work or exercise; shortness of breath, palpitations, his heart beating really fast, sweating, and chest pain. So the problem with this diagnosis, kind of like railway spine, is it actually wasn't blamed on the experience, or that wasn't the experience of being a soldier itself wasn't the causative factor. He believed that it was actually due to exertion and having your pack too tight around your chest. So he believed that it was due to the chest constriction of what the soldiers were carrying that was leading to this condition. It was thought to arise from overstimulation of the heart's nervous system. So that's very much the adrenaline that we see in post-traumatic stress specifically. So there is still a diagnosis for this, and it's called somatoform autonomic dysfunction, meaning that you see a lot of these physical signs, you see the blood pressure and the heart racing and all of these autonomic or organ changes that come from the condition. So it wouldn't be until over 100 years later, it wouldn't be until actually 1980 that we started recognizing post-traumatic stress disorder, that a single event or that an experience could now lead to these mental health symptoms. And I won't go through the whole thing because there's a bunch there and there's a bunch we have to get through. But this is basically a chronic overactivation of your fight or flight system. Your fight or flight is meant to go up. Your adrenaline goes up when you perceive a threat. That's supposed to get you ready to either address the threat, as in fight, or to get away from the threat, which is flight. And then as soon as you're in a safe place again, this adrenaline and all of this fight or flight system is supposed to shut back down so that you can calm down, you can sleep, you can be yourself again. However, in post-traumatic stress, this fight or flight system never really shuts off. So going through a bunch of the symptoms, what you see is this hyperarousal is the word that we use for the high adrenaline, the on guard, the on edge, the restlessness, the never being able to shut down, and especially with the trouble sleeping. So it takes an exposure to a trauma, and even if it's not one of these, what we call a big T trauma, where you'd be like, okay, everyone would agree that that is a traumatic experience. Little T's are the traumas that if it was one event, maybe not, right? But the fact that it happens repeatedly over and over and over again gives you the same sense of helplessness, gives you the same sense of not being able to protect yourself. So it engages the fight or flight system in the same way. Stay on guard, stay on edge, don't let the next bad thing happen. So some of the symptoms, and we just cluster them together. These are the ones that we call intrusive symptoms. This is the troubling memories, the nightmares, the distressing dreams, the flashbacks, that kind of thing. And then this is when somebody gets triggered or reminded of the traumatic situation, when that full fight or flight response kicks up due to the memory, more or less. There's avoidance symptoms, and you see this throughout the records of Civil War vets as well, is that when you start having these symptoms based on cues, you start removing yourself more and more. You start withdrawing, you start isolating, even from friends and family. Another cluster of symptoms we call the negative symptoms is the inability to remember. Sometimes there's blank spots in your memory. There's negative beliefs. Maybe you blame yourself, or maybe you feel that the world is dangerous, chaotic, So even the way you perceive the world changes based on the trauma. You may detach from others, isolate, have more trouble feeling happy or the other positive emotions, really stuck in that kind of depressed or angry or scared state. And then there's the hyperarousal symptoms. So this may be angry outbursts or being more irritable. This is the hypervigilance, which means your head is on a swivel. Every noise, every movement, you kind of got to identify it. Higher startle response. You have more trouble concentrating, focusing on things because now all of the rest of this stuff becomes distracting. And a lot of the sleep disturbance. That's something that you'll, as I've been doing the reading and studying on this, you see it in just about every soldier's record is now insomnia, trouble sleeping, they're up all night, they're agitated, they're having nightmares. So it's actually sleep disturbance and nightmares are the most prevalent PTSD symptoms. Occurs in 90% or more of people with PTSD. So in a lot of ways, that is what maintains the illness over a period of time. If you can't sleep, your fight or flight, your adrenaline can never shut down. And then just to tie it up, these symptoms have to occur for over a month for us to call it post-traumatic stress. If it's less than a month, we call it acute stress disorder. But these symptoms can last for years and years. So some of the horrors that you might have seen, some of the things we'd call some of those big T traumas on the battlefield was the invention of the mini ball. You know, it wasn't just that I forget what you call it. It wasn't just the musket ball anymore. Now it was actually made in a cylindrical shape, far more accurate, far more deadly. The Gatling gun actually came out towards the end of the war, and this was a 6-barreled rotating gun that was actually that day's equivalent of the machine gun. You could quickly change out barrels, you could shoot over 400 rounds a minute. Improved cannons. Artillery was a big part of the war, and there's plenty of stories about soldiers sitting next to each other, and then in a second one vanishes. So the improved cannons led to far more casualties on the battlefield, even without the direct fighting that would come with musket or rifle fire. There's a certain amount of helplessness that comes with receiving artillery fire, which I can tell you. There's not necessarily someone to attack because you don't know where it's coming from, and it can hit in a second. So there was also much hand-to-hand combat. So it was assumed that the soldiers would run out of ammunition and therefore fix bayonets and charge. So you get a lot more gruesome battle in that way as well. So just as an example, in the Battle of Shiloh, over 13,000 Union casualties, 10,699 Confederate casualties. In the 7 days battle, almost 16,000 Union casualties, over 20,000 Confederate. In Melbourne Hill, over 5,000 Confederates fell in one failed assault. So any one of these things you can see could be considered big T trauma, right? These are combat traumas. And there's a whole list of others that I'm not going to get into, but there was plenty of big T trauma to go around during the Civil War. But not just on the battlefield, there was plenty of horrors and traumas that occurred off of the battlefield as well. One example is the Confederate prison in Andersonville. You know, I'm sure that you've all heard of that, yes? I don't know if you've seen any of the images, but it originally was built for 10,000 men, and at its peak, it actually housed over 32,000. So you can imagine people living on top of each other. There wasn't sanitation, so you would be defecating 2 feet from where you were sleeping, from where you were eating, if you were eating. Prisoners would often get in fights and kill each other for what little food or other things that they had. A third of the soldiers died just from disease and exposure and starvation. In fact, during the Civil War, twice as many died from disease as did from combat. So this is another one of those things that you see. If you have a rifle in your hand and you're fighting, sure, that can absolutely be traumatic. You lose a friend, you get wounded, whatever. But there's a certain amount of control that comes with being able to hold a rifle and fight back. Disease, much like artillery fire, is not something that you have a sense of control over. And therefore, now you don't see these noble deaths. Now you see men wasting away. You see somebody dying, lying on their back, with that sense of helplessness, nothing you can do about it. So that's what makes something more traumatic, is that sense of not having any control and then having something bad happen. So there were tens of thousands of amputees as well, people who were previously healthy, expected to provide for their families, all that kind of thing. And now the major treatment for a wound during the Civil War, especially a bullet wound or a shrapnel wound, was amputation. It was basically to prevent infection. Like, a bullet hole may have been small, but it was a dirty wound. So a surgeon would decide whether or not you were likely to get an infection and therefore a fever, and they were more likely to just amputate the entire limb because at least that was a clean wound. But then tens of thousands of men would go back to their farms or to their houses unable to maintain employment, unable to maintain the farm. So then saw themselves as less than men because of the inability to provide. Long marches, low rations, inclement weather, all of this. And then there was Andersonville. So let me jump through that. But I think we can agree that all of these horrors on and off the battlefield would qualify as big T traumas, right? So, sorry.
Okay. So I'll jump in now. So how do people actually cope with things? Or how do we know how people cope with things? There's a lot of written accounts. So we're getting a little bit of feedback on that. There's a lot of written accounts by people who were going through it at the time. There's a lot by nurses that were involved with it. There's a lot of going back to this idea of morality and the traits and the characteristics, there's a lot of views that came into this. When people were talking about the things that they were experiencing, there was caution with how they talked about it. There was this idea that people were aware that there were changes in themselves, but nobody was attributing it to what they were experiencing specifically. There's descriptions of people hardening as they started reducing how they experienced emotions. We know that there was the nostalgia, the homesickness that people were noticing, but when they described people kind of reaching the end of the ropes, it was more the experience of being played out or taking a dark turn. How they actually coped in the moment is much of what we see how people cope today. There was a lot of dark humor. There was a lot of joking around about the things that they experienced as a way of just dealing with it. There's accounts of the amputees being in the hospital and making jokes about how now they were going to be good husbands because they couldn't run away from their wives. There were people coming back and being covered in all sorts of things and making jokes that they just weren't looking that attractive today. We see that there's a lot talking about the conditions that they're going through, the changes in their bodies. Humor was huge. Religion played a role as well, both for motivation but also for distracting and stopping kind of the unwanted thoughts that they were having. We know that a lot of people wrote home as a way of kind of processing through what they were going through. But again, there was a lot of caution in how they wrote about things. Because again, there was this idea that to struggle with something was a personal weakness. It was a character flaw. But you would get these written descriptions about people who weren't able to sleep because they were so awed by the things that they had witnessed that every night it kept coming back to them and it kept them from actually being able to sleep. So they would write home and talk about the things that were going on or talk about the things that they were looking forward to. We also know that getting letters from home meant an awful lot to them. It could also be a source of stress as things were being written in a certain way, and you would see people at a certain point getting kind of tired. But at the same time, when letters stopped coming, people would reach out even more. People would give up hope. There would be like a failure to thrive. There would be a loss of morale. So the writing was a way of not feeling so alone, feeling that there was something after this, that there was a reason why they were there. We know that there were people who would kind of straggle behind, which was illegal, which it was frowned upon. It was considered to be a weakness. But sometimes people were exhausted. And so while there's a reluctance to admit it, you would go ahead and through kind of reviewing what people wrote or how they kind of discussed their experiences, you would see that they were stepping back from things because they just couldn't handle it anymore. We know that the relationships that they have with each other were huge. That as things continued throughout the war, there was a lot of downtime. Being able to connect with one another meant a lot. They got each other through a lot of things. All of these things were coping mechanisms, but they also didn't work so well when people were getting home. A lot of the things that we do to cope now, just like with the Civil War, can be very effective in the moment, but they're not always well received when we go home. The dark humor that helped them at that time did not fit in with the time period. People who hadn't been through the war did not understand the humor. The loss of camaraderie with the people that had gone through it left a lot of people feeling alone. The writing, which made it very easy for people to communicate, didn't continue. Now they were actually having to look at people kind of face to face. So again, the things that helped them to cope weren't necessarily there when they made it home. Now actually adjusting and coming back home seems like it would be fantastic. There are so many accounts of people being excited when they found out that things were actually over, but it didn't just end then. There's a process to being able to return home. We saw that actually a lot of the young men that were getting ready to go home didn't quite experience things the way they wanted to. A lot of people were provided with their last paycheck or back pay, and in the process of leaving, they were robbed, they were taken advantage of, people spent their money not wisely. The return home, it was a lot of exposure going through big areas. They were returning home in uniforms that were torn, and it was a spectacle. When they finally did go home, they didn't always receive the welcome that they expected, even in northern communities, that there are descriptions of people returning home and expecting people to be there and say, hey, how's it going? It wasn't there. In fact, like right after the Civil War, there was a lot of struggle in terms of finances. There was a lot of veterans who came back and they were stuck in poverty. Jobs were completely gone. Entire families lost their wealth. There was a big economic downturn with the recession. Not having work, not having something to do, feeling like you can't provide for yourself, that does not make things easier. So when we look at mental health, not everything is a trauma response, how we see it today. Sometimes it's that feeling of being lost, and we saw it with the Civil War soldiers. It contributed to the feelings of depression and anxiety. It led to a lot of feelings of rage and isolation. The sleep problems that they were having didn't go away just because the war had ended. I put the visions up there because what we think about as re-experiencing or nightmares or intrusive memories were viewed as being visions. There was still a lot of stigma about the people that were coming back and being viewed as being different. In addition, the cost of war took a toll on people that didn't necessarily experience the injuries like the amputations or the gunshot wounds. There was a lot of illness. There was a lot of weight loss just from the starvation and not having enough food. It took a big toll on people's bodies. We saw a lot of people who struggled with chronic pain. Kind of the go-to method for treating pain at that time was actually with opioids. That wasn't just with military, that was just with the general population at that time. We saw a lot of people were actually turning towards alcohol to go ahead and help get them through it. And at that time, those were considered to be moral failings when people went a little bit too far over. Now, looking at the finances, being a Civil War veteran wasn't necessarily held in high esteem either. There's a lot of people who wouldn't hire the veterans when they returned home because they were considered to be a liability. So there were some people who could come home and they had positions and everything, but there's a lot of these that would come home and there was nothing for them. In addition, when you're gone 3, 4, 5 years, you come back, there's a lot of change. So what we see is that people came back and there was a sense that things weren't the same and they weren't quite fitting in. There were people who came back and their entire families were gone. There was no support system in place for them, or they came back and they had children and their children were much older, or the people that were still around, the men who hadn't served, there was this sense of us versus them being different. And again, here they are and they're struggling and they don't know who they are. To have that struggle with it being viewed at that time as being a character trait, with it being a personal issue rather than a result of going through these horrific conditions, a lot of people felt really alone. There's a lot of questions about masculinity, about identity, about purpose. A lot of that contributed to the rage that we saw. A lot of that led to people pulling away even more, which did not help with the trauma symptoms that they were experiencing and the problems that they were having. Especially in like the first few years afterwards, we see that that kind of struggle for trying to make sense out of everything kind of came into play. I do want to say there's a bunch of news articles that came out before we get into treatments. Not everything's just from the physician side of things. Not everything's from the military. We see the newspapers actually talk about things. And in keeping with what we see with military even today, about 10 years afterwards is when it really hits kind of the public attention that we have a bit of a problem here. We need to do something different because so many people are struggling that they just didn't know what. So it kind of ties into like what the treatment was at that time.
So, like I had said, the main treatment at the time was this type of moral therapy, which was getting away, being supported, being in a quiet, serene environment, maybe doing some manual labor, but not difficult, as in something that was productive, kept you busy, fulfilling, maybe some gardening or something of that nature. Doctors would administer whatever their mixture of choice was, but it was usually a mix of either opiates or stimulants or alcohol, as in one of the tonics was milk, eggs, sugar, and whiskey. Now we call that nowadays a cocktail, but it was medicine back then. So most Civil War veterans who entered the asylum never actually left it. That was the one place where they would be less symptomatic. There was often stories about people would be discharged because they would be better, and then they would go right back to being symptomatic when they got back to their communities and end up being readmitted. I like to quote Lincoln in this, because this was really the impetus for a lot of the institutions back in the day. But let us strive to finish the work we are in, to bind up the nation's wounds, to care for him who shall have borne the battle, and for his widow and his orphan. So this was a major push after the Civil War, seeing the amount of mental health, seeing the amount of sacrifice that the soldiers had made. Now it was not a guarantee, but it was a promise made by the president, by the government, to take care of these veterans in the aftermath. So another way to look at moral therapy, I think this is yours.
It is. So basically, people were kind of isolated. In terms of the adjustments, they would go to a place and there's a huge emphasis on just slowing down. There was a little bit of structure, but not a whole lot. There also wasn't a whole lot of privacy. Now, when we looked at some of the asylums, and Greg will get into them, if you had money and you could pay for some private things, it was a different experience. But for the vast majority of people, it was shared spaces. So almost everything you did, you were doing with a cohort of people. Yes, you were spending time outdoors, you were getting fresh air, you were getting some exercises, but it was in a very small area and people were pretty stuck. They would build in some recreation, but it was only the recreation that was considered to be appropriate or approved at that time. There's also a huge emphasis on the providers or the people overseeing it, making the decisions, and then the people actually receiving the care, their families would just kind of go with it.
So here are some of the institutions that I wanted to bring up. These were more or less a brand new idea, as in bringing it to the common person. and the impetus was to take care of the soldier. So things were done a little differently in the North than they were in the South, even in this institutional age. So St. Elizabeth's Hospital was originally built in 1852, and it was meant to be an active duty hospital for both the Army and the Navy. It was built outside of DC. It was supposed to be a mixture of treating the mentally ill, but also the physically ill during the war. It ended up, it opened up in 1855, but it opened up with the need for mental illness and the treatment as the government hospital for the insane. So it was designated to be one of these safe places, one of these sanctuaries, asylums for that kind of moral therapy. It was built for farming and for gardening. Initially, the West Lodge was the first of the hospitals that was opened. That was the one that was designated for the Navy and their treatment of sailors during the war. The east wing of the main building was used as the Army General Hospital for sick and wounded soldiers. This was St. Elizabeth's, that part of the hospital was known as the St. Elizabeth's Army Medical Hospital. So what you see is a significant ramp up of the number of patients that were admitted to the hospital over the period of the war and afterwards. So between 1860 and 1861, there was only 95 patients admitted that entire year. But then in 1862, that more than doubled. Now 212 soldiers were admitted, or 212 patients were admitted, 2/3 of which were soldiers. In 1863, it went up nearly double again, 1.5 times, to 357 admitted. And in 1864, nearly doubled again to over 569. So talking about the original intention of the asylum, to have that space, to have that sanctuary, like Dr. Morris was talking about, the idea that the more and more crowded any of these institutes become, the more the people are living on top of each other, the more that the space is limited. A lot of these were supposed to be single rooms, more or less, but quickly had to start doubling up. Another thing that I was reading about, didn't put on the slides, was actually that a lot of these asylums were set up kind of in a spoke and wheel pattern, and the middle is where the most well-behaved patients would be. So there was almost like a merit system. The ones who were had more behavioral issues or were more violent were kept farther down the wing, and then as their behavior improved, they would be brought back up. But now it was impossible to do that with the overcrowding. So now you have maybe have a very depressed, very passive soldier rooming with somebody who would have violent outbursts and do all of this. So you lost a lot of the point of the moral therapy as our hospitals became more and more overcrowded. So by the end of the war, over 1,500 soldiers had become patients at St. Elizabeth's. In the South, so St. Elizabeth's was meant to be a federal facility. Soldiers from anywhere, any of the Union states at least, if they showed any signs of mental illness or insanity, within 3 years of their discharge, they would be taken from wherever they were and they could be sent to St. Elizabeth's, and then that was covered by the government. So as in before, there were only private institutes and families had to pay. This was part of that promise to take care of the soldier, was that if they were found anywhere else in the Union, they could be sent to St. Elizabeth's and taken care of. However, in the South, they maintained a decentralized kind of system, so every state kind of ran its own asylum. Every state had variations in the way that they would treat the mentally ill. So Western State Lunatic Asylum was an asylum in Virginia. It was actually the second within Virginia. This one was founded in 1825, so even before the war. It actually opened its doors in 1828. Its first director was Dr. Stribling. He was very close to Dorothea Dix, so he was very influenced by her push for the humane treatment of the mentally ill. So he embraced moral medicine, moral therapy for Western patients. He was one of the first 13 who founded the American Psychiatric Association, which is the organization that I'm a member of to this day. South Carolina had its own version. South Carolina State Lunatic Asylum. It was founded in 1821, so again, well before the war. However, it didn't open its doors until 7 years later because of costs and other delays. It's actually the third oldest mental institution in the United States. But before 1860s, the census, so the number of patients residing there, was actually very low. It was kept under 200. They were actually, to their credit, admitted black patients on the same basis as white patients, but there was only 5 that were admitted in 1865. The census by 1900, which is the next count that I could find, it was up to over 1,000. So within that 40-year period, and a lot of it continuing to rise after the war, now it doubled and tripled and went up to 5 times its intended number of residents. Nearly all of them were state beneficiaries. So South Carolina State was supposed to be about half private payers and about half destitute or unable to pauper pension, as in maybe the government would throw in a little bit, but they would be doing this more or less for the good of the person and the good of the community. It was meant to be half and half. But again, shortly after the war, with all of the increase in soldiers and other people who were admitted, more and more became unable to pay. So now nearly half of the residents were black at the time. And instead of this humanitarian type treatment, this moral therapy with the intention of somebody recovering, now they really changed over to a state of custodial care, which is really just, we're going to keep you alive and we're going to keep you taken care of for the rest of your life, but you're probably not getting better. Central State Hospital is out of Georgia. This was established in 1837, opened in 1842. It was meant to be an institution as family model of care. So if the family couldn't take care of the patient, the institution was going to become their new family, caring and taking care of them in whatever way that they did. In the 1860s, it too had to convert to this more custodial system, almost giving in to the idea that somebody couldn't recover from their illness. Increasingly, the population became chronically ill or organically disturbed, was another way of saying it back then. The first freed blacks were actually admitted in 1866, so right after the end of the war. Even that next decade, the physician-to-patient ratio was 1 to 112. This was not so unusual at the time. Nowadays, you see every patient every day if you're in the hospital. Back then, once a week, you would kind of make your rounds and walk around and see who needed your attention. But you would get around to seeing everybody. There was no expectation that you're getting out of here in 4 or 5 days. This was, we'll see how you're doing in a month. But by 1910 was the next date I could find. The population had increased to over 3,200 patients. So residents were actually, in this case, in order to make up for the lost revenue and the hospital losing on finances, the residents were actually made to farm the estate. So now it was less of that moral therapy, doing something fulfilling. Now it's, you're gonna go work the fields because of your inability to pay. At the same time, shortly after the Civil War, the federal government started the soldiers' homes, and Milwaukee was one of the original 3. This had a similar purpose to the moral therapy. This was a sanctuary where soldiers could be around other soldiers, where they could be taken care of and they could feel part of a new community. So in March of 1865, Lincoln signed the legislation that would establish this national system of homes for disabled vets. The Milwaukee Soldiers Home, which is now, the original grounds was all for the Soldiers Home, but it's where you see the Milwaukee VA now. And some of the original structures are still there. This was established in 1867. It was meant to be a true asylum, a place of refuge and healing, a place for veterans to recover and recuperate, and eventually transition back to society. So in April of 1864, it was actually the women of Milwaukee that got together and raised the money for creating this temporary home for veterans, the first building that was on the grounds. They raised over $100,000, which today would be over $2 million to obtain the property and the charter for the construction. In 1866, they transferred that money and established the National Asylum for Disabled Volunteer Veterans. The governor's residence was added in 1867. Milwaukee's Soldiers Home, or Old Main is what we call it nowadays. It was just rehabbed and it's a beautiful facility. If you ever get to take the tour on the VA grounds, was established in 1869. This was that centralized model for housing and then having all of the services that a veteran would need, both medical and even entertainment or recreation. There was a chapel and a theater and other things right on those grounds. So that's why you see the VA grounds is so huge, is because it was meant to be a community of its own. The soldier would never really have to leave. So it was renamed in 1863 to the National Home for Disabled Veterans. They rebuilt Old Main just recently, but eventually systems like this were converted into what we call the Veterans Health Administration nowadays. So these were the original impetus for the VA hospitals. Some of the other things that I just wanted to touch on in just the last minute we have here left is that the Civil War and the mental health after the Civil War highly affected our society, American society. Alcohol, drinking, was a big way of coping during the war. And even soldiers who wouldn't drink before the war, continued to use that coping mechanism after coming home. So that led to a lot of alcoholism that may have been actually the inspiration for a generation later, leading to prohibition. Alcohol leads to a lot of disinhibition and other problems that come up. But again, back in this day, they had the cause and the effect backwards. Now they thought the mental illness was due to the drinking, rather than the drinking being the coping for the mental illness. So then they were retroactively blamed for poor character or intemperance, causing their symptoms. This was America's first opioid crisis. So morphine and opium were used throughout. They were the only kind of pain relievers or anesthetics other than alcohol during the Civil War. So a lot of the Civil War veterans came home already addicted to opiates. And this was back in the day where there were no laws against substances. So cocaine was legal and you could get it in a pharmacy. Heroin actually was invented by Bayer, the same one who created Bayer aspirin. It was meant to be a more potent opiate, so better pain relief, and also it slows digestion, so it's used for diarrhea, but without the addictive effects. Right? And you could actually buy heroin, including the syringe, and you'd get a carrying case. Up into the early 1900s, you could order it right out of the Sears and Roebuck's catalog. Yeah. In 1868, it was estimated that between 80,000 and 100,000 Americans were addicted to opium. Other things just to bring up too that I didn't get to put into the slides. There was a significant increase in suicide, especially in the South. So in the South, and the idea of the moral character and not being able to provide for your family, the institutions weren't the place that they would go. You saw a significant increase in the number of suicides in former soldiers. The amount of domestic violence increased incredibly. So these were some of the soldiers coming home. Maybe they were prone to violent outbursts, maybe they were taking their frustrations out on others, but that's something that is hard to find in the records because it was something that wasn't generally talked about. Now it became more talked about because it was that big of a problem. And other things that have affected us for the next 100 years were some of these social problems that we're still seeing nowadays that have kind of fed on themselves. One thing about trauma is that trauma gets passed through generations, and it's not genetic. They believed that there was a inheritable source of mental illness back then. And there are some in some of the diagnoses, but trauma is not one of them. What happens is when the soldier has been afflicted or when the person's been afflicted, now they have enough trouble taking care of themselves, constantly in that fight or flight state. And now that, even if it's not abuse, the disorientation, the confusion, the lack of consistency in the parenting, all of this leaves the children in a state where they're far more susceptible to traumas of their own, that insecurity as a child and that kind of thing. Now their fight or flight gets kind of locked up in that higher level, and it can be seen traveling from one generation to another kind of through that route. Other things you want to wrap up with?
I think it's important to say too, not everybody reached that level as part of their struggle when they were coming back. There's a lot of individuals who came back and they were able to manage and effectively cope with the things that they had experienced. We know that I'm just struggling with this. It's me. We know that there are protective factors that for people who are a little bit older, who'd already had some coping, who already had supports in place, they tended to fare a lot better. A lot of the struggle that came with some of these men as they came back really affected to a higher level people who are really young. So we have a lot of teenagers. We have a lot of people who didn't have a whole lot of life experience, where their entire world was kind of shocked. They were shocked when they went through this. And when they came back, they struggled the most. There was a study that was done, and I can't tell you who did it off the top of my head, but they looked back at all the data that they had from military records and pension records and kind of death records. And what they found is that the risk of mortality for these really, really young men was way higher than you would have expected. Not only from things like suicide or from the substance use, but just overall, their bodies took a beating. We know that GI issues and cardiovascular issues were really common for a lot of the individuals who came home, even if they weren't necessarily struggling with some of the symptoms that we see with like the trauma or the isolation. So it was an entire experience that people went through. We also see that positive happened too. So if we're talking about the struggle afterwards, people made positive changes even if it didn't seem at that time. I was reading one account as we were getting ready for this about the impulsivity. It's not uncommon for people to come back and feel restless, especially when you're feeling like you don't have a place where you belong. And so we see that some of the expansion that happened after the Civil War happened because people were looking for a sense of purpose and meaning. And so we see some positive that comes out of that too. So I think it's important to highlight that. Not everything is necessarily the worst, that there is good, and people have resiliency and they have strength. And
Absolutely. So thank you all for your attention. Thank you for being here. I hope it was useful. We'll stay up for a little while in case there's other questions or comments that you have. Yes, sir.